Hi, I guess I don't know how to do this, but it's a pleasure to see everyone this evening. I thought that I guess I'm just talking, which is fine. And I'm just going to move myself over a little bit. Oops, and there's a phone ringing, so excuse that. I just wanted to say thank you for letting me come and speak with you all this evening. It's such a pleasure. I got to get out of my pajamas, which is excellent. And I'm just going to share a little bit of how we practice at Wholistic Vision Care. My name is Anuja Joshi, and I practice in Brewster, New York. I always try to explain that our kind of care is holistic with a W. And so that lets us look at all aspects of the patient, and it lets us determine what's best for, hey, Carrie, it's so nice to see all my classmates and to be in touch this way. It's great. Thanks, Dr. Resnick and Dr. Glazier for allowing me to do this. I have no financial disclosures, and I, like last week's speaker, Rana, I am a Canadian, and I graduated from ICO, which seems from a really long time ago now. And after graduation, mostly I worked in ophthalmology. And after that, I was lucky enough to get the opportunity to join a private practice in Evanston, Illinois. That practice was called North Shore Eye Center, and it was owned by Dr. Millicent Knight. And that was really a fortunate opportunity because Dr. Knight was already practicing holistic vision care. She was really a great advocate for patients to understand how they can be well. And she counseled patients on lifestyle choices, nutrition, and ways to stay healthy, including the ideas of doing good exercise and ways to manage stress. I will always be grateful to her for introducing me to the idea that optometry and wellness go hand in hand. I was fortunate to be in Chicago for a few years, after which we were transferred to New York for a little bit, and then we were transferred on to Asia. And in Asia, I worked in an eye hospital that was really integral, again, in that it was an eye hospital that was cutting edge technology, but it also allowed us to look at other parts of the culture that helped patients understand disease, understand wellness. They now are really also embracing holistic care as well, and use Ayurveda and yoga in treating their patients. After Bangalore, we were in Salt Lake City for a little while, and then back to New York. All those past experiences were wonderful because they allowed me to create a framework for what was to come. And that was quite serendipitous, actually, because 4 years ago, just a little over 4 years ago, I purchased a practice here in Brewster. And hey, Kelly, the practice in Brewster was really already practicing holistic care. It was called Holistic Vision Care prior to my even being there. And Dr. Ross, who is no longer with us anymore, was a proponent of good choices, healthy choices, and he would make sure that his patients understood how important it was to eat well, to exercise, talk about supplementation, and he loved his MPOD. The MPOD is a macular pigment density measuring device, and it helps us to quantify macular pigment. And so when we can do that, we can provide ideas for patients to be able to keep their pigment density at good levels. And he would suggest that patients use lutein, zeaxanthin, astaxanthin, and various other AREDS2 vitamins, as well as antioxidants, in order to help them with that. He also loved digital retinal imaging, and all the established patients are always asking to look at the back of their eyes, because Dr. Ross was so good about communicating how well we can understand our health by looking at the blood vessels at the back of our eyes. I think that he would be just thrilled with OCT and OCTA as various methods of technology to help continue to create that discussion between patients and doctors. In optometry, as you all know, we are in a unique position that we can treat diseases, but we're also the first line doctors for many patients who might not go to their doctor. They come and see us, and so that gives us the responsibility and the opportunity to teach them about staying well. So these are well patients coming for well visits, and great options. Oh, Dr. Resnick is asking me, do you find your practice grows faster due to the subspecialization, and do you take specific courses? I think that we can grow faster in that we have a broader net for patients. So where locally, of course, we have our regular patients. When patients know that you are practicing in slightly more diverse methods, they do come from further away to see you. I had a patient call from upstate New York the other day with regards to dry eyes, and not just talking about the dry eye problems, but all the facets of dry eye. So yes, Dr. Resnick, I would say that the subspecialties, whether they be this particular one or any subspecialty, do allow your practices to define themselves in a different way, and thus have a broader net in order to get patients. Did I take specific courses? You know, I'm always reading. I was taking a functional and integrative class through the College of Integrative Medicine. I'm looking at a class that through Duke University, and Ayurveda is actually kind of part of the way we grew up and eating well. So not specific classes. The Ocular Wellness Society is also very beneficial for optometrists because it really does talk about nutrition. And I did start my fellowship there. I had yet to finish it, but all these sorts of things I am pursuing. Not any specific degree in nutrition as such, but definitely taking various courses through these different avenues, whether they be the Ocular Wellness and Nutrition Society or functional and integrative medicine opportunities through universities and various other colleges. And that being said, that brings us to talking about patients who are not so well. So whether it's diabetes or hypertension or even just borderline patients. I know we don't like using the word borderline, but those are the greatest patients that will benefit from counseling, advice, and ideas to help them keep well. So sometimes those patients who are having difficulty, who are unwell, who are older, trust us because we're not direct primary caregivers, so we're less, we cause less fear or anxiety. And fear, anxiety, sickness are all stressors to your body. And so we talk about methods to mitigate risk based on stress. And when someone is anxious or fearful, that is something that we need to pay attention to. The other part of being holistic with a W is talking to patients and incorporating the discussion with their other healthcare providers. It's very important to be part of the loop. And again, whether that's their physical therapist, do I believe in homeopathy? I don't not believe in it, but I think homeopathy and supplementation all have to be done wisely. People who use Similicin eye drops, for example, I think those are fine because they don't necessarily cause any damage. But when your homeopathy is using small bits of medicine that actually make you unwell to make you well. And I would say that the best way to be homeopathic would be to refer or include a naturopath or a homeopathic doctor who has a lot more information on that than me. So I work with a naturopath and very closely, and we are able to, this particular naturopath, he creates various, oh, my old classmates are here. It's so exciting. Hi, everyone. So I would say that I believe in homeopathy. Do I prescribe homeopathy? No, because I think that homeopathy would be another subspecialty that one with the right, oh, Luigi, nice to see you. With the right information, we have to guide our patients carefully. It is our responsibility to keep them well. And homeopathy is one of the many facets of holistic vision care. The other thing that we talk about is supplementation. We talked about the MPOD and how I Promise is we use I Promise, as do many people, but it suggests to patients that would help keep the integrity of the macular pigment, and you can quantify that using the MPOD. But if you don't have an MPOD, it's really important to talk to patients about macular health. So again, in the holistic idea of using AREDS2 vitamins, various antioxidant vitamins, really important to, hey Marsha, to be able to have these discussions in order and have the discussions with the right information. So we have to be careful with certain supplements when we talk to patients about taking vitamins, because they may interfere with the way their regular medicines work. So sometimes we talk about mirtogenol and pycnogenol because they're very, very good antioxidants, and they could have a role in glaucoma suspect patients for hey Pune, for example, to lower IOP. However, if someone's taking a blood thinner, that's not necessarily a good option for that patient. So these are things we really do have to think about. Again, holistic incorporates the whole part of how we eat, also genetics. So if a patient is well, but we do actually have a very good, Dr. Resnick was asking about chiropractors and osteopaths. There's Dr. Knight, yay. But I do. So in our little town, we have a holistic caregivers group that Dr. Ross had started, including chiropractors, osteopaths, homeopaths, even a homeopathic and a holistic veterinarian, so that we can have this communication for patients who are looking for ideas to stay healthy. Nutritionists, osteopaths, chiropractors. One of my osteopaths is a pain specialist. So when we talk with patients with regards to inflammation, a lot of the time their main complaint is pain. So we do definitely not market so much as communicate and integrate with chiropractors, osteopaths, primary care physicians, anyone that will help create wellness, exercise physiologists, fitness people. Again, it's about balance. And that's also something that we talk about. The famous Dr. Knight. I'm kidding. I am thinking about Dr. Knight, not remembering what I'm supposed to talk about. And Dr. Knight was really, again, instrumental in introducing me to the importance of wellness, not just looking at supplements, but looking at lifestyle, stress, thinking about yoga and breathing, and those really important things. They seem simple, and wellness is not something that you can take a magic pill for. So that's something else that we think about. We want to be able to teach patients that to be well, we have to put in some effort. We have to understand how we're feeling and why we're feeling that way. So along with the nutrition and chiropractor, osteopath part of it, sometimes patients complain of certain things, and we're like, well, why is that happening to you? And I ask them to journal. It doesn't seem like it fits into the optometry box, essentially. However, it helps me to troubleshoot. If I know if a patient is having certain symptoms, are they happening because they're eating certain things that are causing allergies, or are they causing imbalances within our gut? The gut microbiome is actually a new sort of thing patients have to be. Don't they ever, Dr. Right Knight? They have to be your partner. This is not something that I can give you a magic bullet and you're going to be better. It is entirely about communication and understanding and following through with the recommendations. Because sometimes, we can say, do this, 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 write it out, give them all these recommendations, have the supplements or the information available to the patients. If they don't come in and join you, that does become difficult. So it really is our job to incorporate that. I don't do the products online as yet. However, well, that's not entirely true. I have some product in the office, and then if patients are looking for other product, I do give them the websites to be able to directly purchase from those places, whether it's I Promise or Doctor's Optimal Formula or various other recommendations, or the naturopath that I use, he formulates special vitamins for the office. So I will give them that information if they would choose to continue to purchase those things. Again, it's not just about purchasing product, it's about understanding that this is a lifestyle choice, and to help patients incorporate that lifestyle choice into their daily lives. I do. I send, and so did Dr. Ross, actually, Dr. Resnick, not only to the primary care physicians, but to any specialist that needs to be in the loop. So whether it's the rheumatologist, the neurologist, the allergist, again, we're part of a team, and this team is important in providing wellness for the patient. That way we're all on the same page. So if someone is on a blood thinner and I've said, use mirtogenol, pycnogenol, that may not work so well for them. Or the primary care physician may say, yeah, that's great, I'm glad you're doing that. And we've seen that most recently with an older patient who had some difficulty, and we were able to troubleshoot as a team between the primary care physician, the cardiologist, and myself, because retinal blood vasculature can be affected by many things. I have not yet invested in an antioxidant scanner. I know that there's a very well-known doctor in Chicago who does have one, and there are various things, antioxidant scanning and biofeedback mechanisms that you can use. I am not necessarily in an area that patients they're receptive to recommendations, but they're not necessarily wanting to do too many extra tests. Product use, I think that again, if you can incorporate it into the whole method of the way you are consulting with these patients, it's important. But again, it's not the only thing. I do talk about nutrition. We talk about Ayurveda, for example, where you're looking at balance. I don't want to only be selling or talking about product to my patients. I want them to understand that the products will help, but a lot of it, again, is the way we are going to talk about health. Again, product use, maybe even makeup or laundry detergent for that matter. So if that's something, I don't know, Carrie, if that's, again, something that you, but I think that it's really important to talk to patients about what goes close to their eyes or into their, near their mouth or into their bloodstream, because all these things will affect their health. So, yes, structure, fees, exam, extra discussions. I am in the belief that if I'm doing the right thing by my patient, that my exam fees exam fees will be able to. I don't have specific wellness fees, for example. I do have a wellness fee for certain photographs or scanning that we do, or the MPOD, because those are technology based fees, but I don't build in a fee for this sort of consultation. It's part of my eye exam, and I'm proud to be able to own that. And our practice is very well known for care. And that is something that we're very proud of giving, very good quality care. Myopia management, we have that discussion even with people who aren't myopes. Children who come into the practice, really important to understand, go outside. It's really simple. Play outside. I wish classrooms would be outside. Now it would even be, with this whole virus thing, it would be better for keeping kids far apart. But the myopia management part of it starts again with education. Children who come in who are emmetropes, who are 6 or 5 years old, encourage them to, and encourage their parents to continue spending time outside, sunlight, fresh air, understanding that when we are inside, whether it's looking at a screen or in the four walls, those walls are inhibiting our eyes from seeing as far as they possibly can. And that part of myopia management, and then the idea of what are the right kind of glasses to wear. Not just a single vision pair of glasses anymore. We have to think about executive bifocals, and we have to think about Eyezen lenses. So in our practice, our choice single vision in quotation marks lenses is an Eyezen lens, because it provides us a wellness lens. It's preventing a blue light from bothering our eyes, and it's also helping us a little bit with accommodative strain. So these are really important educational mantras that we must encourage, not just subspecialties to incorporate into their practice, but optometry as a whole, because we are first-line caregivers. And in order for our patients to be well, especially in these trying times, wellness is really important. Fighting inflammation, managing myopia. Dr. Vesnick is how to advise a call. Really care for your patients. Do a little bit of research. If you think everything is available to us at the moment, and we may even have a little bit of extra time, it's a blessing. With that little bit of extra time, you can spend that with your patient over the phone. Dr. Rana Taji last week was talking about telehealth. Wellness exams are so easy when you're using telehealth. To have that discussion, to do the consultation with the patient and seeing them as well. That would be a great way to start a holistic practice. But to really understand that holistic practice does mean understanding how patients are living. So for the inflammatory eye disease part, I think that it's really important to see lifestyle choices. Are they on the computer too long? Are they stressed? Are they worried? Are they depressed? What are they eating? There's a very strong correlation between gut microbiome and your eye and your brain. So that's a whole new area of study, which is fascinating to me, because the gut microbiome, it changes and it's unique for each person. So that can be affected by geography. It can be ethnicity, as well as what you eat. But so to look at it, I would say to to journal, like we were saying with patients, to keep an idea of what people are eating and see what the reactions they're getting. So we talk about anti-inflammatory diet, we talk about exercise and breathing. Good quality oxygen feeds your entire body. So those are really important. So recommendations for diet: sensitivities, talk about gluten sensitivity, talk about organic fresh fruits and vegetables. We have to eat good quality oils. It could be that patients are vegetarian, just say. So what kinds of omega-3s can we suggest? Or omega-6s, gamma-linolenic acids are so important when we're talking about health and wellness and anti-inflammatory eye disease. Yeah, OCT, I will. I think the idea that dementia and, again, we talked about pycnogenol. Pycnogenol is really important for aging and the oxidative stresses that happen with aging. So the new technologies for screening for dementia, really important. I think OCTA is going to be in our realm for helping patients and how we address Alzheimer's. If we look at amyloid in the brain and amyloid in the eye, these are really important things. The only way we can educate our patients is by introducing them not just to supplements and lifestyle, but to talk to them about these technological advances, because they really appreciate that. I hope that answered the question, Dr. Resnick. But if I was to invest in something in the near future, it would be OCTA. To see how blood vessels work is phenomenal. And we always are so fortunate that when we dilate the eye or look in the eye, we get to be, they are the windows of the soul, but they're also the windows to the brain function and heart function. Oh, great. I'm sure you'll tell me what they are. I will look into that, Dr. Resnick, because I'm not aware of other screening technologies for dementia at the moment. But I think that if we put those all together in our practices, that it will be wonderful. And I hope I don't sound like somebody to you, but I would really be interested in seeing what other technologies are available for dementia screening, as well as the antioxidant screenings. We thank you. What else can I answer? Any more questions? Let me see what Dr. Richard is saying here. Otherwise, is it patients who are interested in prevention need to know? Well, that's interesting. Okay, so, I've only owned this practice for 4 years, and Dr. Ross had it before. There was no set fee. We do genetic testing. For those particular tests, there are extra fees, but for the consultation during a regular eye exam, I don't have a separate fee. However, when the patient comes back, just say I had them journal their diet and symptoms, then we would incorporate that into their intermediate exam fee. Is there a separate out-of-pocket cost? Not as yet, but I agree with that. I agree with everything that perhaps it sounds like dabbling, and I would, yes, I should charge more. Dr. Resnick, you are absolutely right. And I think that's a great idea. It does, not only with I was doing the Arctic DX test for the macular degeneration, but I do not do it anymore. Yes, Dr. Knight, exactly. The beta amyloid plaque on is a biomarker for Alzheimer's. In New York, we're a little bit, we're not allowed to perform a lot of tests, extra testing, but I don't do the genetic tests right now. I do consult with the primary care physicians, and we approach it that way. I don't have a very good relationship with a lab that does genetic testing at the moment, but it is something that I will be looking into more, as especially if I'll be able to then feel that charging a suitable fee would be corroborating the evidence that we are getting. But that's right. We should charge. I am notorious for not charging the patients enough. But I do love what I do, and sometimes it's just that pleasure in guiding patients in wellness that is the fee. Thanks, Dr. Resnick, and thank you everyone for tuning in. It was my first time doing this, and it was really lovely. Thank you so much, and if anyone has more questions, let me know, and I hope that was helpful. Thank you so much.